Health Promotion and Maintenance Part 1. What equipment would be necessary to complete an evaluation of cranial nerves 9 and 10 during a physical assessment? A. A cotton ball. B. A pen light. C. An ophthalmoscope. D. A tongue depressor and flashlight. The correct answer is D. A tongue depressor and flashlight. Which technique would be best in caring for a client following receiving a diagnosis of a stage 4 tumor in the brain? A. Offering the client pamphlets on support groups for a brain cancer. B. Asking the client if there is anything he or his family needs. C. Reminding the client that advances in technology are occurring every day. D. Providing accurate information about the disease and treatment options. Correct answer is D. Providing accurate information about the disease and treatment options. An 8.5 lb 6-ounce infant is delivered to a diabetic mother. Which nursing intervention would be implemented when the neonate becomes jittery and lethargic? A. Administer insulin. B. Administer oxygen. C. Feed the infant glucose water. D. Place infant in a warmer. The correct answer is C. Feed the infant glucose water. What question would be most important to ask a male client who is in for a digital rectal examination? A. Have you noticed a change in force of the urinary system? B. Have you noticed a change in tolerance of certain foods in your diet? Do you notice polyuria in the AM? D. Do you notice any burning with urination or any odor to the urine? The correct answer is A. Have you noticed a change in the force of urinary system? The nurse assesses a prolonged late deceleration of the fetal heart rate while the client is receiving oxytocin IV to stimulate labor. The priority nursing intervention would be to A. Turn off infusion. B. Turn the client to the left. C. Change the fluid to ringer lactate. D. Increase mainline IV rate. The correct answer is A. Turn off the infusion. Which nursing approach would be most appropriate to use while administering an oral medication to a 4-month-old? A. Place medication 45 cc of formula. B. Place medication in an empty nipple. C. Place medication in a full bottle of formula. D. Place in supine position. Administer medication using a plastic syringe. The correct answer is B. Place medication in an empty nipple. Which nursing intervention would be a priority during the care of a 2-month-old after surgery? A. Minimize stimuli for a client. B. Restrain all extremities. C. Encourage stroking of the infant. D. Demonstrate to the mother how she can assist with her infant's care. The correct answer is C. Encourage stroking of the infant. While performing a physical examination on a newborn, which assessment should be reported to the physician? A. Head circumference of 40 cm. B. Chest circumference of 32 cm. C. Acrocyanosis and edema of the scalp. D. Heart rate of 160 and respirations of 40. The correct answer is A. Head circumference of 40 cm. Which action by the mother of a preschooler would indicate a disturbed family interaction? A. Tells her child that if he does not sit down and shut up, she will leave him there. B. Explain that the injection will burn like a bee. C. Tells her child that the injection can be given while he is in her lap. D. Reassures child that it is acceptable to cry. The correct answer is A. Tell her child that if he does not sit down and shut up, she will leave him there. During the history, which information from a 21-year-old client would indicate a risk for development of testicular cancer? A. Genital herpes. B. Hydrocele. C. Measles. D. Undescended testes. The correct answer is D. Undescended testicle.